Hello, welcome to our channel. Today we are going to be talking about one of the most popular herbs in Ayurvedic medicine, ashwagandha. Ashwagandha is a powerful herb that has been used for centuries in traditional Indian medicine to improve overall health and well-being. In this video, we are going to discuss the benefits of ashwagandha and how you can incorporate it into your daily routine. What is ashwagandha? Ashwagandha is a plant native to India and North Africa. It is also known as Withinia somnifera or Indian ginseng. The root and berry of plants are used to make medicine. Health benefits of ashwagandha: reduces stress and anxiety, boosts brain function and memory, lowers cholesterol and blood sugar levels, improve fertility and sexual function, helps with weight loss and muscle building, may reduce inflammation and prevent cancer. How to take ashwagandha? Ashwagandha is available in many forms including capsules, powder and tincture. It is best to start with a low dose and gradually increase to avoid side effects. Ashwagandha can be taken with food or an empty stomach. It is recommended to take ashwagandha in the morning or evening for the best results. Doses of ashwagandha. The optimal doses of ashwagandha can vary depending on a person's age, weight and overall health status. In general, the recommended dose ranges from 300 mg to 600 mg per day taken in divided doses. For anxiety and stress, a dose of 125 mg to 500 mg of ashwagandha root extract can be taken twice daily for 8 weeks. For people with chronic stress and adrenal fatigue, a higher doses of 600 mg to 1000 mg of ashwagandha root extract can be taken daily. For improved sleep, a dose of 300 mg to 500 mg of ashwagandha root extract can be taken 30 minutes before bed for up to 6 weeks. For people with low testosterone levels, a dose of 5 gram of ashwagandha root powder can be taken daily for 3 months. It is important to note that the optimal doses of ashwagandha may vary depending on the individual needs and health conditions. Always consult with a doctor before starting any new supplement regimen. Side effects of ashwagandha. Ashwagandha is generally well tolerated when taken in recommended doses. However, some people may experience mild side effects such as upset stomach, diarrhea and nausea. People who are pregnant, breastfeeding or have autoimmune diseases should avoid taking ashwagandha without consulting with a doctor first. In some rare instances, ashwagandha may lead to allergic reaction in certain individuals. If you encounter any negative effects after consuming ashwagandha, stop taking it immediately and seek medical advice from a doctor. In conclusion, ashwagandha is a popular herb that has been used in traditional medicine for thousands of years. Its benefits range from reducing stress and anxiety to improving cognitive function and physical performance. While it's generally safe for most people, it's important to consult with a healthcare professional before taking ashwagandha and any other supplement. Thank you for watching this video. We hope you found this information helpful. If you have any question or comments, please leave them below. Don't forget to like and subscribe to our channel for more videos like this. Thanks for watching. Bye bye.